What if the most dangerous thing about your body right now is not what you feel, but what you've trained yourself to ignore? You're in your 20s, 30s, or early 40s. You eat on the go, push through fatigue, blame every stomach issue on stress, late nights, or just something I ate. Blood on the toilet paper, hemorrhoids, constipation for weeks, not enough water, exhaustion that sleep doesn't fix, busy life. Unexplained weight loss, finally dropping those extra pounds. We have been taught that colon cancer is an old person's disease, something that happens to people after 60 or 70. That belief is quietly killing young adults. Colorectal cancer is now the leading cause of cancer death in men under 50 and the second leading cause in women under 50 in the United States. Cases in people under 55 have roughly doubled in recent decades. Many of these cancers are being diagnosed at later stages because the early signals were dismissed by patients and sometimes even by doctors as nothing serious. The difference between a 91% 5-year survival rate and a 13% survival rate often comes down to whether someone paid attention to subtle, persistent changes months or years earlier. If you are young and healthy looking, this message is especially for you. Your age is not the protection you think it is. Hello everyone, and welcome to Health Journey, where we bring you science-backed health information to help you live a healthier and longer life. Today we are going deep into 7 early signs of colon cancer that most young people ignore. We will explain each one thoroughly, what is happening inside the body, why these signals get dismissed, real-life patterns, and exactly what you should do. We will also cover causes, risk factors, prevention, nutrition, lifestyle habits, common myths, and practical daily steps. This is not fear-based content. This is information that can save lives when acted on early. Always remember, this is educational information based on current medical understanding. It is not a diagnosis. If you have symptoms or concerns, talk to a healthcare professional. Colon cancer, more precisely colorectal cancer when it involves the colon or rectum, usually begins as small growths called polyps on the inner lining of the large intestine. Most polyps are harmless, but some can slowly turn into cancer over years. In younger adults, the disease can sometimes behave more aggressively or be diagnosed later because screening typically starts at age 45 for average risk people, and symptoms are often attributed to less serious problems. Early detection changes everything. When found localized, 5-year survival exceeds 90%. Once it spreads widely, outcomes drop sharply. That is why recognizing the early, often subtle signs matters so much. Let us begin with the first major warning sign. Persistent change in bowel habits is one of the most commonly overlooked signals. Your normal rhythm, whether you go once a day, twice a day, or every other day, is unique to you. When that pattern shifts and stays shifted for more than a few weeks without a clear reason such as a new medication, major diet change, travel, or illness, it deserves attention. This can look like new constipation that does not resolve with fiber or water, ongoing diarrhea, or a frustrating alternation between the two. Some people notice stools that have become consistently narrower, pencil-thin, or ribbon-like. Others feel an urgent need to go yet produce very little, or they feel as if the bowel never fully empties. What is happening biologically? A growing polyp or tumor can partially obstruct the passage of stool, slow transit time, irritate the lining, or alter the way the colon contracts. Inflammation and changes in the local environment of the gut can also affect water absorption, leading to looser stools. In younger adults, these changes are frequently blamed on irritable bowel syndrome, food sensitivities, stress, or just not eating right. The problem is that true functional disorders usually have a longer history or clear triggers. A new, sustained change after age 20 or 30 that has no obvious explanation is different. Studies of early onset colorectal cancer consistently show altered bowel habits as a frequent presenting feature. Diarrhea appears more commonly in younger patients than the classic constipation pattern sometimes seen in older adults. The key word is persistent. Occasional constipation after a low-fiber weekend is normal. Constipation or diarrhea lasting 3 to 4 weeks or longer, especially if it comes with other symptoms, is not something to normalize. A common real-life story involves a young professional who starts having to plan bathroom stops carefully, or who notices the need to go multiple times in the morning, yet never feels finished. They try probiotics, cut out dairy, drink more water. When nothing fully resolves it, they adapt and live with it. Months later, a colonoscopy reveals a lesion that has been growing quietly. If this describes you, document the change. Date it started, what the stools look like, any associated discomfort, and bring it to a doctor. Do not wait for it to become dramatic. The second early sign is bright red blood in the stool or on the toilet paper. This is the symptom with one of the strongest associations with early onset colorectal cancer. Research shows rectal bleeding can raise the odds of a diagnosis several-fold compared with people without it. Bright red blood usually means the source is lower in the digestive tract, near the rectum or left side of the colon. It may appear as streaks on the stool, drops in the toilet water, or spotting on the paper. Many young people immediately assume hemorrhoids, especially if they have strained or sat for long periods. Hemorrhoids are indeed common and often the cause. The critical point is that you cannot reliably tell the difference by looking. Cancer-related bleeding and hemorrhoid bleeding can look identical. Doctors have historically been more likely to attribute rectal bleeding in a 30-year-old to hemorrhoids without further investigation. That pattern is changing as awareness grows, but delays of several months from first symptom to diagnosis remain common in younger patients. During those months, a treatable early cancer can progress. Any blood that appears more than once or that continues even if you think the hemorrhoids have improved needs evaluation. Blood that appears with a change in bowel habits, abdominal discomfort, or fatigue raises the urgency further. Do not let embarrassment keep you from mentioning it. Healthcare professionals hear about this every day. The third sign is dark or black, tarry stools. This looks different from bright red blood. When bleeding occurs higher up in the colon or further along the digestive tract, the blood is exposed to digestive enzymes and bacteria as it travels. The result is stool that appears black, sticky, and often foul-smelling, sometimes described as resembling tar. People often flush this away without realizing what they saw, or they attribute it to something they ate, iron supplements, bismuth medications, or dark foods. True melena, tarry stool from blood, has a distinctive appearance and odor. It signals that blood has been present long enough to be chemically altered. In the context of possible colon cancer, black stools can indicate a lesion on the right side of the colon, where tumors may grow larger before causing obvious blockage because the right colon has a wider diameter. Right-sided cancers can therefore present more insidiously with anemia and darker stool rather than bright red bleeding. If you notice black stools that cannot be explained by diet or medication, contact a doctor promptly. This is not a wait-and-see symptom. The fourth early sign is unintentional weight loss. This means losing weight without changing how much you eat, without increasing exercise, and without trying. Losing 10 pounds or more over a few months for no clear reason is a red flag across many conditions, including colorectal cancer. Tumors can interfere with nutrient absorption, release substances that suppress appetite, increase the body's metabolic demand, or cause chronic low-level blood loss and inflammation that affect overall energy balance. Some people notice they feel full quickly or have less interest in food. Others keep eating normally, yet the scale keeps dropping. Young adults often celebrate unexpected weight loss or attribute it to stress or a busy season. The body does not usually shed weight this way without a physiological reason. When combined with any of the bowel symptoms already discussed, the concern rises significantly. Track your weight if you have other symptoms. Bring the numbers to your appointment. The fifth sign involves persistent abdominal pain, cramping, or bloating that feels different from your usual gas or menstrual discomfort. This is often vague, a dull, ongoing ache, a sense of pressure, or intermittent cramping that does not fully resolve. It may be more noticeable after meals or in certain positions. Abdominal pain was one of the most common symptoms reported in studies of people diagnosed with early onset colorectal cancer in the months to years before diagnosis. The pain does not have to be severe or emergency level. Vague brewing discomfort that is new for you is enough to warrant attention. Tumors can cause local inflammation, stretch the bowel wall, or create partial obstruction that produces gas and bloating. Many young people try elimination diets, antacids, or over-the-counter gas relief and adapt to a new baseline of discomfort. That adaptation can delay care. If the pain is persistent, progressive, or associated with bowel changes or blood, seek evaluation rather than continuing to self-manage. The sixth sign is iron deficiency anemia, or the fatigue that often accompanies it. Chronic, even small amounts of blood loss from a tumor can deplete iron stores over time. The body may not show dramatic bleeding, yet laboratory tests reveal low hemoglobin, low ferritin, or iron deficiency. Symptoms of anemia include unusual tiredness that sleep does not fix, weakness, shortness of breath with mild activity, pale skin, dizziness, or headaches. In young women, these findings are sometimes attributed solely to menstrual blood loss. While heavy periods can cause iron deficiency, persistent or unexplained anemia still requires a full workup, including consideration of gastrointestinal blood loss. Studies have identified iron deficiency anemia as one of the 4 red flag signs associated with higher likelihood of early onset colorectal cancer. If a routine blood test shows anemia and there is no clear explanation, or if you feel chronically drained despite adequate rest, ask about further investigation. Fatigue is easy to dismiss in a high-pressure life. When it is new, profound, or paired with other symptoms, it is information your body is giving you. The 7th sign is a persistent feeling that the bowel does not empty completely, sometimes called tenesmus, or the consistent production of narrow stools. After a bowel movement, you still feel the urge or a sense of residual stool. Stools may become progressively thinner. This sensation occurs when a mass near the rectum or lower colon interferes with the normal emptying reflex or physically narrows the channel. It is different from the temporary incomplete feeling that can follow constipation. When it becomes a regular experience, it needs evaluation. Many people describe planning their day around bathroom access or feeling anxious about whether they will be able to go fully. These quality of life changes are valid reasons to seek care. Taken together, these 7 signs, persistent bowel habit changes, bright red blood, dark or black stools, unintentional weight loss, ongoing abdominal discomfort or bloating, iron deficiency anemia or unexplained fatigue, and incomplete emptying or narrow stools form a pattern that should never be ignored, regardless of age. Having more than one of them increases the association with early onset disease. Even one persistent unexplained sign is enough to discuss with a doctor. Now that we have covered the signs in depth, let us look at what is driving the rise in younger adults and who faces higher risk. The exact reasons cases are increasing in people under 50 are still under active study. Genetics play a role in a minority of cases. Roughly 10 to 20% involve hereditary syndromes such as Lynch syndrome or familial adenomatous polyposis. Most early onset cases do not have a clear inherited mutation. Lifestyle and environmental factors appear important. Diets high in ultra-processed foods, red and processed meats, and low in fiber have been linked to higher risk. Excess body weight, particularly visceral fat, insulin resistance, and metabolic dysfunction create a pro-inflammatory environment that can promote abnormal cell growth. Sedentary behavior, heavy alcohol use, and smoking add further risk. Emerging research is examining the gut microbiome, including certain toxin-producing bacteria, early life exposures, and even environmental chemicals. No single factor explains the entire trend. It is likely a combination acting over years. Risk is higher if you have a first-degree relative, parent, sibling, or child diagnosed with colorectal cancer or advanced polyps, especially at a younger age. Inflammatory bowel disease, ulcerative colitis, or Crohn's disease increases risk with longer duration of disease. Certain genetic conditions require specialized screening schedules. Being overweight or obese, having type 2 diabetes, eating a Western-style diet, and low physical activity are modifiable factors that apply across ages. Screening guidelines now recommend starting at age 45 for average-risk adults. People with higher risk factors may need to begin earlier, sometimes 10 years before the age at which the youngest affected relative was diagnosed. Screening methods include colonoscopy, which can both detect and remove polyps, stool-based tests that look for blood or abnormal DNA, and other options your doctor can discuss. Colonoscopy remains the most complete examination when symptoms are present. Prevention rests on habits that support a healthy colon environment. A diet rich in fiber from vegetables, fruits, whole grains, and legumes helps move waste efficiently and feeds beneficial gut bacteria. Aim for a variety of colorful plants. Limit processed meats, bacon, sausage, hot dogs, deli meats, and moderate red meat intake. Choose fish, poultry, beans, and nuts as protein sources more often. Maintain a healthy weight through balanced eating and regular movement. Physical activity, whether walking, strength training, or sports, has been associated with lower colorectal cancer risk. Avoid tobacco completely and limit alcohol. Stay hydrated and manage stress, as chronic stress can influence gut function and inflammation. Some evidence supports the role of adequate vitamin D, calcium, and overall dietary patterns, such as Mediterranean-style eating. These are supportive measures, not guarantees. The strongest prevention tools remain early awareness of symptoms and appropriate screening. Common myths still circulate. One is that young people simply do not get colon cancer. The data show otherwise. Another is that rectal bleeding is almost always hemorrhoids and can be ignored. Evaluation is required to know the cause. A third myth is that if you feel fine overall, nothing serious can be happening. Early colorectal cancer is often silent or produces only mild symptoms. A fourth is that colonoscopy is only for older people or is unbearably invasive. Modern preparation and sedation make the procedure far more tolerable than many expect, and it can be life-saving. Practical daily habits reinforce protection. Notice your bowel patterns without obsession. Simply be aware of what is normal for you. Respond to persistent changes rather than adapting around them. Include fiber at most meals. Move your body most days. Keep routine medical care and blood work so anemia or other signals are not missed. If you have a family history, share it clearly with your doctor and ask about earlier screening. Key takeaways. Colon cancer is rising in younger adults. Early signs are often subtle and easily dismissed. Persistent changes in bowel habits, any unexplained rectal bleeding or black stools, unintentional weight loss, ongoing abdominal discomfort, signs of anemia or profound fatigue, and incomplete emptying deserve medical attention. Early detection dramatically improves outcomes. Lifestyle choices support risk reduction but do not replace awareness and screening. You have more power than you may realize. Paying attention to your body's signals is not hypochondria, it is self-respect. Many people who catch this disease early go on to live full, healthy lives. The ones who wait often wish they had spoken up sooner. If anything in this video resonated with a change you have noticed, make the appointment. Write down your symptoms. Bring a list. Ask direct questions. You are your own best advocate. Thank you for spending this time with Health Journey. If this information helped you or someone you care about, please like the video, Subscribe for more science-backed health content, leave a comment sharing what you found most useful or any questions you have, and share this video with friends and family who need to hear it. Your engagement helps us reach more people with information that matters. Take care of yourself, listen to your body, and we will see you in the next one.